Welcome back, everyone, to Open Line. Glad you're with us tonight. We're talking about how the coronavirus is impacting the homeless community. A lot of good calls. We're just going to go right back to the phones here. Let's go to Eugene. Hello, Eugene.
It's Ray Jean.
Ray Jean, I'm so sorry. Sorry. Okay, go right ahead. Ray Jean.
This topic really touches me because I was never really homeless except for a couple of weeks when I was in my teens, but I know that many problems start from being abused as children or suffering some kind of emotional abuse. And even if you're very intelligent or you get an education, like this lady mentioned that some of the homeless have different educational levels, that still cannot overcome the trauma, particularly if you don't have family support. And I relate to these people very much because a person like me who has high education and very skilled, I still suffered a lot of setbacks in my life. And I don't know, between God and just being determined to survive, I was able to overcome. But it took many, many years. And what I know that people who are on their having a hard time, they really need is they need hope. They need to know that it can be done, that they can overcome, even if they're alone and there's nobody to help them. And my book that I wrote called Angels Among Us is a book that would provide so much hope for people. I'm telling you, if I wrote the book because I had experienced the worst possible life experiences that you could have. Child abuse, not having family support, being sort of on my own, but still somehow I survived. And I wanted to
Regine,
put it
thank you. Yeah, I'm glad you're sharing your story. And I want to ask Dr. Fleisch, as being a medical director of street psychiatry, what about what she's saying there, the impact of trauma on people's lives? What about what you're hearing her say?
Yeah, about 97%, nearly 100% of individuals who experience homelessness have had some sort of trauma in their life. And then whether it's a chicken or the egg, does the trauma come before homelessness, or does homelessness cause the trauma? And during homelessness, also, there's incredible criminalization. And there's also what we call, homeless on homeless trauma. There's criminalization among people who experience homelessness as well. And so what she's saying is absolutely true. And I think the other thing that she said is that sometimes it just takes one little path in one direction. And that's true whether you're experiencing homelessness or not. But I think certainly, as I mentioned before, also with even a housing voucher, if you have a really small number and you happen to be the person that was selected, your life may go in an entirely different direction than the other person on the right hand who wasn't selected for that housing voucher. So I'm so pleased to hear that her life has taken, the path on the left hand where she was able to ultimately get an education and write a book and do so well. And I think what she's also highlighting is that we have to think about everybody in the world as a human and as a person, and treat that person like one, and look that person in the eyes, because we really never know their story until they choose to share it.
And Paula Foster, Dr. Fleisch was talking about this coronavirus pandemic will likely increase the number of homeless people. Have we seen that here in Nashville? I don't know if you have new numbers. I don't know how often you count. Do we have a sense? I mean, clearly the economy is suffering. Clearly, right. Many people have lost jobs. Have we seen an increase? Do we know yet?
We don't have numbers in terms of that at the moment, or not that I have seen at this point. And I want to echo what Dr. Fleisch said about trauma. as a licensed clinical social worker, in this field, she's right. You don't know what comes first, the trauma or the homelessness and the trauma. It's all intertwined. And I want to say to our caller and to Billy, the caller before, we see life through our own lenses, and we think we know what everyone else is experiencing based on what we've experienced. And what I want to remind folks is that we don't really know what everyone else has been through, and we don't know, that person that we see over there that we think, well, they're young, they're able-bodied, they should be working, but we don't really know their whole story, and we don't know what trauma that they have experienced in their lives. And let me just say this: living in poverty is experiencing trauma, and it is pervasive, and it breeds more trauma. And when you don't have the resources to pick yourself up and move on, then you can't. And so I want us all to try to remember and find that place in us that your last caller, you said it, she had a small experience of homelessness in her life, but she was able to figure out how to move forward and do something different, and has come to a different place in her life. Not everyone has the same opportunity. And what we need to do as a community is to try to create those opportunities for everyone. So part of it is, Dr. Fleisch is right, from a federal perspective and a local and a state perspective, we've got to figure out how to create more housing that folks can actually get into and can afford and can find safety in, and then have access to health care and be able to take care of themselves. Because given the choice and given the resources and given the opportunity, people choose to live in houses and choose to take care of themselves.
Right. Okay. All right. We're going to take a break. We'll come back, take a break, be back right after this.